You've probably heard about diabetes, right? It's one of the most common chronic diseases in the world, and it really all comes down to how our bodies use energy. So in this explainer, we're going to break it all down, what it is, what to look for, and most importantly, how it's managed. All right, let's jump right in.
To really wrap our heads around this, let's start with a really big question. What actually happens when your body's fuel system, the very thing that keeps you going, starts to break down? This is the core problem we're going to unpack together.
So, for our first section, we're going straight to the heart of the matter, what we're calling the body's fuel problem. We're going to get into the mechanics of what's going wrong, right down to the cellular level.
So, when you strip it all down, what is diabetes? Well, at its core, it's a condition where the amount of sugar, or what's called glucose, in your blood is just consistently too high. And that happens because the body's having a really tough time using its main source of fuel. The best way to picture this is with a simple analogy. Imagine every single cell in your body is like a tiny little engine. The glucose you get from food, that's the high-octane fuel for those engines. But here's the catch. The fuel can't just get in on its own. Every cell is locked, and that fuel needs a very specific key to open the door.
And what is that all-important key? It's a hormone called insulin. Your pancreas makes it, and its entire job, its whole purpose, is to unlock your cells and let that vital glucose flood in. And this comparison just lays it all out perfectly. Look at the left side, a healthy body. The insulin key fits the lock. The cell door swings open, glucose rushes in, and bam, you've got energy. But now look at the right side. In a body with diabetes, something's gone wrong with that key system. Either the key is missing, or the lock is kind of jammed and the key doesn't work anymore. Either way, the result is exactly the same. Glucose can't get into the cells, so it just builds up in your blood, all while your cells are literally starving for the fuel they need to function. So this whole internal fuel crisis, how does that actually show up on the outside? What do you feel? Well, that brings us right to our next section, decoding the warning signs. You know, these problems we just talked about, they don't happen silently. The body sends out signals.
And here are some of the big ones. Because your cells are starving for fuel, you feel totally wiped out. That's the constant fatigue. With all that extra sugar floating around in your blood, your kidneys go into overdrive trying to flush it out, which leads to frequent urination, and that, of course, makes you incredibly thirsty. The high blood sugar can even mess with the lenses in your eyes, causing blurred vision, or it can slow down your body's ability to heal. See, they all trace right back to that fundamental fuel problem. And I want to be really clear about this. These aren't just small annoyances we're talking about. If that high blood sugar is left unchecked for a long time, it can cause some really significant, lasting damage all throughout your body. So why does this happen? Well, think of all that extra sugar in your bloodstream like sandpaper for your tiny blood vessels. Over time, it damages them, and this can lead to some very serious long-term issues, like damage to major organs, your kidneys, your heart, and even to your nervous system. This is exactly why catching it and managing it early is so incredibly important.
Okay, this naturally brings us to a really key point. Not all diabetes is the same. So in Section 3, we're going to explain the three main types. And this is crucial, because getting the right treatment all starts with knowing which type you're dealing with. Let's just walk through this. First up, type 1. This is an autoimmune issue. For some reason, the body's own immune system attacks the pancreas, so it basically stops producing insulin. The key just isn't being made. This is usually found in kids or young adults. Now, type 2, this one is by far the most common. In this case, the body either doesn't use its insulin right, the lock is jammed, or it just can't make enough to keep up with what the body needs. This is often tied to lifestyle. And finally, there's gestational diabetes, which, as the name suggests, pops up during pregnancy when there's a temporary insulin shortage.
All right, now for what I think is the most important part of this whole conversation. Knowing there's a problem is one thing, but what in the world do you do about it? Section 4 is all about empowerment, your path to control. Here's the thing. Successfully managing diabetes isn't about one magic bullet. It really rests on 4 essential pillars that all have to work together. The foundation is your lifestyle. That means a healthy diet and getting regular exercise. Then you track how you're doing with the third pillar, keeping a close eye on your blood sugar. And guiding this whole process is the fourth pillar, working with your medical team and always staying educated. Now, the specific medical piece of the puzzle looks different depending on the type. For type 1, remember, the body isn't making that insulin key at all. So the treatment is lifelong insulin, given either with injections or an insulin pump. But for type 2, the approach is a bit different.
It often starts with oral medications that help your body use its own insulin better, although some people might need to add insulin therapy later on. So managing the day-to-day is one thing, but preventing those serious long-term problems, that's where being proactive comes in. Think of this as your essential health checklist. It means getting regular eye exams, taking really good care of your feet, keeping tabs on how your kidneys are doing, and of course, having regular check-ins and an open line of communication with your whole healthcare team.
And this really brings us to the most hopeful and powerful message of all. It's not about a cure, it's about control. And the amazing thing is, with that control, the outlook is fantastic. People with diabetes can and absolutely do live long, full, and very healthy lives.
So maybe the best way to think about a diagnosis is not as an ending, but as a really powerful beginning. It's a call to action. It's a chance to become way more in tune with your body, to make choices that make you feel good, and to truly take control of your own health. And that kind of awareness, well, that makes all the difference in the world.